The Nevada Minority Health and Equity Coalition Public Policy Workgroup presents Advocacy and Policy Change. Thank you for joining us for another in our advocacy series. I'm Tom McCoy, Executive Director, State Government Affairs for the Nevada Chronic Care Collaborative and co-chair of the NMHEC Public Policy Workgroup. Joining me is Leanne McAllister, Nevada Chapter American Academy of Pediatrics. Leanne, I'm sure we've got some people watching that are volunteering for an organization in terms of advocacy or thinking about volunteering. And as I understand it, you are pretty much a volunteer for the advocacy work that you're doing, and yet you have a professional and a family life. How do you balance all that?
Oh my goodness, it's a wonderful question. And there is a wonderful book about essentialism, about really making an intentional effort to say yes to the things that are your priority and no to the things that are not, and to make time for the things that are your priority. So, for example, I just got back from the annual American Academy of Pediatrics National Conference and Exhibition. I've been going on and off for 20 years. It is my passion. It is how I deal with professional burnout. It is the organization that really fuels me. But after the conference was over, I took 3 days off of work because the conference was in Orlando to make sure my family and I had some magic time in the theme parks in Orlando. So being intentional about what you say yes to and what you say no to is critical. And that's where, for me, over the last several years, the Nevada Minority Health and Equity Coalition has been a real partner in that there are so many advocacy issues that I personally and the physicians that I represent care about, but trying to advocate for 30, 40, 50 issues is not realistic. But picking the 2 or 3 that I share with coalition members, now that's a good use of my time because I'm helping myself, my members, and our partners at the coalition to focus on what is practical and getting done.
That's a good lead into a question about how does the AAP, Nevada chapter, decide what's going to be, well, what's going to be the issues that you want to bring, those 2 or 3 that you just mentioned? Uh,
Absolutely.
yeah,
And it's a process that the American Academy of Pediatrics has had for 94 years. Everything at the Academy is policy based. So there are 68,000 pediatricians that are members of the American Academy of Pediatrics. They work in committees and sections and councils to come up with policies on breastfeeding recommendations, policies on obesity prevention and healthy living. They are all based in evidence-based medicine, public health policy. And then those policies drive the advocacy work because we know now what we have to do for children, right? Children are 22% of the population, but 100% of the future. We know what we have to do for children to make them as healthy as possible. How do we now turn that into actual legislation? And then what we do here in Nevada is we look at what the AAP policies are recommending and what they care about. And then I specifically ask all of my members, all 280 members, to fill out a survey. And they get a month and they don't have to do it in one sitting. But the survey asks them, okay, of these 10 issues, which is number 1, which is number 2, which is number 3. And for the last several years, gun violence prevention and protecting kids against gun violence has been voted number 1. But it gives every physician who's a member of the chapter an opportunity to say where we should prioritize our efforts.
are there other provider groups that you work with on making these decisions or getting support for legislation or support what they're doing?
Oh, yes, absolutely. So certainly the Hospital Association, they helped to work on the HOPE Act last session to get Medicaid coverage for all children in the state. The hospitals know what the pediatricians know, which is that their health care should not depend on how lucky or unlucky they were to be born in a certain zip code. or in certain situations, and that all of their health care has to be paid for. We work very closely with family practice doctors because family practice doctors see children as well and are worried about the same type of advocacy issues that we are. And then, of course, the state, Nevada State Medical Association, which is the state level of the AMA. Here at the national level, the AMA and the AAP work very closely together. And in the state, whenever we can, we come together. And Nevada is a little unique too, in that we also have very strong county physician organization. So Clark County Medical Society, they have their own very localized issues and priorities, but when they overlap with what I'm trying to do with the AAP, it makes for a wonderful partnership.
Well, that brings up a question of, do you as an organization get involved at, say, something that's coming before a city council in Las Vegas or Reno that might impact your mission?
Well, our mission, so the tagline is dedicated to the health of all children, and our mission is to support the pediatricians who care for the children in our state. Because I'm a volunteer and I'm the only staff member at the nonprofit, it is all member led. It is all member run. So while we might not be at every city council meeting or every school board meeting, certainly when there's an issue on the agenda that speaks specifically to one of my members, they're the ones that are taking the time to show up. I, on behalf of the members, try to show up as many things as possible, but as only one person, I can't always be in all places. But again, this is where the coalition comes in handy, because maybe I'm not going to be at the meeting, but I know another member of the Nevada Minority Health and Equity Coalition is, and I can give them AAP resources to help them to prove their point of why we need certain legislation.
An organization like CAA would be something that would work for you, I guess.
Yes, the Children's Advocacy Alliance is such a powerful organization on behalf of children in Nevada. And so, yes, where they cross with the work of the Minority Health and Equity Coalition, those two, you two are my strongest partners.
What's the best approach? What have you found to be the best way to get to a legislator at the Nevada State Legislature on behalf of an issue that your organization cares about?
Absolutely. So, and I'm a Massachusetts transplant. I've been here 6.5 years. And the one thing I had to learn switching from Massachusetts to Nevada was in Massachusetts, it's a year-round, full-time legislature with huge staff, and each staff member has their own expertise. In Nevada, our legislators are unbelievably hardworking, part-time people trying to just get the right thing done on behalf of children. And I found that when I listen to what our legislators already care about, what they're already moving forward, and I show up to support them because it overlaps with my priorities, they see that I have showed up for them, and I can have the opportunity to tell them where I need them to show up now for me. And they'll look into it. Maybe they'll support, maybe they won't, but at least I get them interested in learning more about a topic important to me.
Well, we've got 2025, not that far away, and the legislature will be considering all kinds of issues. Anything in particular that your organization is going to be focused on?
Absolutely. So I have a number of board members that are specifically concerned about different issues. So Dr. Jose Cucurcon Calderon in Reno, he was just named by Becker's Health as one of the 62 people, Latinos to know in healthcare, right? So he is a state treasure, a national treasure. We are lucky to have him. And he cares about so many things when it comes to children's health, but primarily vaping and protecting kids against e-cigarettes, and secondarily immunizations and the awesome power of prevention that we're not able to give to all children because of misinformation and disinformation that's out there. So we will be advocating for removing non-medical exemptions to school entry for vaccines. We will be advocating for much stricter restrictions about who you can sell and even market e-cigarettes to, and vaping products to, and certainly removing flavors. A number of the things that we talked about last session, many of which either passed or came close to passing, we'll be revisiting those with even stronger evidence this time around than we had 2 years ago. Another huge issue is the link between school attendance and health. And we know that children suffer greatly if they can't get into school. And one of the barriers to attending school is school start time. Children and adolescents reach a time when they become nocturnal. It's actually very hard for them to force themselves to sleep early. They can't will the acne off their face. They can't will themselves to sleep. And yet we're sleep depriving them and setting them up for failure by making them start school so early in the morning.
Well, sounds like you've got a busy agenda ahead of you. There are 5 videos in this series. We encourage you to hear the perspectives of other public policy workgroup members on another advocacy and policy change.
Thank you, Tom.
Thank you.